Okay, so we're going to have a look at our happy baby exercise. This is a great way to release some tension in the low back, and probably a bit of a modification from the way that a lot of you would have learned it in yoga, but this is what we're going to do. So we're going to lie on our back, and we just want to begin by trying to get heavy into the back. Reaching the hands up, we're going to take the index and middle finger and wrap that around the big toe. I'm going to continue trying to punch my knuckles and shoulder blades up towards the ceiling, and what you'll feel is that really pushes your mid-back heavily into the ground. I'm going to use my hamstrings to sort of grab onto the sit bone and pull gently the pelvis up into a slight posterior pelvic tilt. And so you may feel that kind of redistributes the stretch or brings the stretch on into your low back a little bit more. At that point, I'm going to start to breathe really deeply. Big exhales and big inhales. And I'm going to try to use that big inhale to target a stretch into the low back area. So we like to use this stretch for people who need to open up some lumbar flexion mobility. People who have a hard time lying on their back and getting their dead bug to really kind of squish into the ground, or those sort of things, or things like if you do some crunches, these sort of motions that you feel like it's hard for you to maintain a contact from your mid-back to low back down to the belt line kind of thing. So after having done this would be a great time to do some of those kind of exercises. But in general, we're using this as a mobility development exercise for people who have maybe a flat curvature in the low back here when they're bending forward, and so that's going to affect a lot of movements in the trunk, and it's going to kind of negatively affect a lot of athletic movements and functional movement patterns just for day-to-day living. So we really want to prioritize and work on that one, try to help open that area up. If this is painful for you at all, you should proceed with extreme caution or maybe look for an alternative until you can settle your back down. But if your back isn't really in a lot of pain, you feel some stretching when you're breathing deeply into this, that's probably going to be all right, and it tends to be a pretty good exercise for helping to gradually open that area up, but this can take place over weeks to months. Okay, so we want to be patient with it and just kind of consistent, and yeah, that's our happy baby to develop mobility for the low back. Hope it helps.